morning viewers. Today we're talking about pain in your hands and in your feet, and in the medical field it's actually known as T4 syndrome, the specific area that I'm talking about. But if you've got people that are complaining of pain down their hands, it could be numbness in their hands, so it's either one hand or both feet included, so all four limbs, all right? It can be just the fingertips, just the toes, the hand, or all the way up to the arm and all the way up to the hips. Basically glove-like distribution is what we call it. So whether you're complaining of pain, decreased sensation, decreased temperature, so cold hands and feet. I've got a lot of patients that complain of cold hands and feet, and they say, oh, it's a circulation problem, but it's not necessarily just a circulation problem. It could potentially be a T4 syndrome problem. Now, what this work does is, in our anatomy, over your level of T4, which is here in your thoracic region, T stands for thoracic, C stands for cervical, L stands for lumbar. So just to distinguish the different areas of your body. Is it in your neck, cervical, C? Is it in your thoracic area, so your rib cage area, T? Or is it in your lower back area, L? All right, and that's how the medical field distinguishes which area of your spine is affected. So we're talking about the thoracic area, so your rib cage area, and in your anatomy from your T4, so T4 means the number of the thoracic vertebrae. You've got 12 of them, so it would be T1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, and therefore you have 12 ribs. Now at T4 up to T9, you have a natural narrowing of your foramen where the blood vessels and the nerves run out in your bones, in your spine. And if you get a compromised spine, so in other words, you get a thoracic curvature or you get a scoliosis where the spine is twisted or sideways or anything like that, where it compromises or alters your biomechanics of your thoracic region, you can then get a compromised nerve supply or blood supply to your arms and your limbs, which then gets classified as a T4 syndrome. And what happens, the symptoms that you may complain about would be, like I said, cold hands and feet, pain in your hands and your feet, or only one limb, or all four limbs, or two limbs, or two of the top limbs, two of the bottom limbs. It varies, which is why it is so sneaky to diagnose. I've had a couple of patients that have had T4 syndrome. Off the top of my head, I can remember about 3 or 4, so it's not a common occurrence, but it is an occurrence that should not be ignored. So the first lady that I had with the T4 syndrome came to me complaining that her hands felt like bags of sand. She said that it was glove-like distribution, and she constantly, all the way through the treatment, would complain, my hands feel like bags of sand and I can't do my buttons and I can't feel because my hands feel like bags of sand. So I don't know if any of you guys can relate to that experience, or feeling of cotton wool in your hands. They feel fat and puffy that you can't quite feel where you are walking. They are numb, they are cold, they can be painful, and but when you look at them, they look fine. And when you do the tests, the Doppler test or any of your tests, and they come back normal. So then what is going on? So when I pushed on this lady's thoracic area, all of a sudden she said to me, oh, but my hands are feeling better. And I then went specifically and had a look and came up with a diagram. I can remember it clearly on the right-hand side of our page, and it was in a green book. I can't remember which book it was in, but I remember on the right-hand side of the page was this little man that had these areas colored in, and they spoke about the T4 syndrome. But when you Google it on the internet, you cannot find any information about it. If you type in T4 syndrome, maybe if you type in other information things, you'll come up with the right search. But yeah, so T4 syndrome is the diagnosis. And all you need to do is work on the thoracic area to mobilize it, to improve the posture in an upright position so that you can improve the supply of nerves and blood supply to the hands and the legs, and the problems will go away. So you would lie on a noodle, like a swimming pool noodles. There's one. So you can chop up your swimming pool noodle, then you'd lie on it on your back area over your thoracic region in the middle of the spine. You just lie on your back on the floor and let it push the areas in so that you can get an upright spine. And this will help to improve the mobilization of your thoracic, in other words, make it more flexible, and therefore decrease the pressure that you're putting on the blood supply and the nerve supply, and thus it will improve the sensations and reduce the pain in your arms and your legs. Very interesting. I had a young guy who'd had heart surgery when he was little, and he'd twisted his ankle and it didn't want to get better. And then when I started working on his thoracic region, his ankle got better. So it was a compromisation of the thoracic region. Even though he'd been operated when he was little and he was now in his 20s, it had caused stiffness of the thoracic area, which then compromised the nerves and the blood supply. And because he had injured his ankle, it wasn't responding to normal treatment because it had a secondary impact of the thoracic spine, which was preventing it from getting totally healed up. Then I had another patient who's had a couple of surgeries on her legs, and she's had a sympathectomy done to try and improve the thermal regulation of her legs, in other words, to improve the temperature in her legs. And it's done nothing to discover that she's actually got a thoracic scoliosis, and when I press on the thoracic area, it actually improves temperature and sensation down in the legs, so therefore she would have a T4 syndrome. So there have been several. I had another lady who was complaining of bilateral weird signs and symptoms in her legs, temperature control, pain, struggling to move the arms and that, and she actually had a tumor in her thoracic region. So we went and removed the tumor and all her symptoms went away. So when you're having symptoms in all four limbs, do have a look in the thoracic region. Don't just look in the neck or look in the lower back. It can also be the thoracic, although the thoracic area is considered to be the one of the most stable areas because the ribs keep it in position, that there's not a lot that can go wrong in the thoracic region. However, don't overlook the T4 syndrome. Thanks for listening. Subscribe and like. Send to your friends and family. Let's help you improve your pain in your arms and your legs. I hope that was informative for you and that you understood it clearly. And if you have any other questions that you'd like to ask, please do send me questions and requests. I do like getting those requests, because then I'll make a special video for you like we did with the ankle rehabilitation. I hope it was useful for you guys. And there'll be a couple more requests coming up now, and we'll chat to you later. Thanks.